Well, as the race for containment and a cure continues, many Americans are feeling the stress and the strain brought on by coronavirus.
Indeed, as President Trump tries to ease the fears of the American public, he's finding himself at odds with some medical professionals. KCAL 9 political reporter Randy Page joins us live to explain. Randy.
Sharon Wan, there are reports, late reports coming out of New York tonight that the long-feared surge of coronavirus patients is beginning to hit the hospitals. They are reporting, for example, they're running out of respirators, they're reusing masks, and there is a tremendous amount of concern tonight as to where this is all going. And while all of us across the country watch New York and wonder, is that what's going to be happening to our communities soon, the whole question of whether or not there are drug therapies or vaccines that can help becomes so important. And then the next question is, when you learn of these possible breakthroughs, who can you believe?
Dr. Fauci, as was explained yesterday, there has been some promise with hydroxychloroquine.
No, the answer is no.
With fear gripping the nation, coupled with the desperate hope for a medical miracle, the collision of politics and science is sending a confusing, mixed message that was front and center in Washington today. Listen as Dr. Anthony Fauci, the nation's leading expert on the treatment of infectious diseases, speaks about a particular drug called hydroxychloroquine that has been used to treat malaria and arthritis since the 1950s. The question is, can it effectively treat the coronavirus?
We're trying to strike a balance between making something with a potential of an effect to the American people available at the same time that we do it under the auspices of a protocol that will give us information to determine if it's truly safe and truly effective.
Now listen to the president's take on the very same drug.
You know, I've seen things that are impressive, and we'll see. We're going to know soon.
So is there a disconnect between science and this president?
The president feels optimistic about something, his feeling about it. What I'm saying is that it might be effective. I'm not saying that it isn't. It might be effective, but as a scientist, as we're getting it out there, we need to do it in a way as while we are making it available for people who might want the hope that it might work, you're also collecting data that will ultimately show that it is truly effective and safe under the conditions of COVID-19. So there really isn't different. It's just a question of how one feels about it.
But can the president's optimistic tone about this medication create a false hope in the American people? That question led to an explosive reaction from the president in this exchange with NBC's Peter Alexander.
Is it possible that your impulse to put a positive spin on things may be giving Americans a false sense of hope?
No, I don't think so.
Misrepresenting the preparedness right now?
No, I don't think so. I think that, I think it's got,
the not yet approved drug.
Such a lovely question. Look, it may work and it may not work. And I agree with the doctor, what he said. May work, may not work. I feel good about it. That's all it is, just a feeling. I'm a smart guy.
What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say. Go ahead. I think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people. The American people are looking for answers, and they're looking for hope. And you're doing sensationalism. Let me just tell you something. That's really bad reporting. And you ought to get back to reporting instead of sensationalism. Let's see if it works. It might and it might not. I happen to feel good about it, but who knows? I've been right a lot. Let's see what happens.
The virus continues to take its toll on the economy as well. The Dow ended the day down 4.6%, closing one of the worst weeks since the 2008 crash and erasing all of the Trump-era gains. While senators scramble to come up with a $1 trillion stimulus bill that calls for direct payments to Americans and expanded unemployment benefits for workers affected by the virus. Tonight, the New York Times, citing a source familiar with the agreement, is reporting the benefits could come close to covering the full lost wages for a typical worker. The top Democrat in the Senate, Chuck Schumer, said it's time for the whole of government to put aside politics and reach out to each other.
I told the president we need to come together and cooperate in this time of national crisis. He agreed. We need to work with uncommon speed and make this next bill what it needs to be. We need it to be workers first, with a Marshall Plan for hospitals. Democrats are already at work with our Republican colleagues to get this done.
In fact, we were told the Senate was expecting to have some kind of an agreement by midnight, New York time. That went by just a few minutes ago. Still no word from Washington, but we do know that they are putting us on the fast track, and certainly any minute would be important. Any minute saved, I should say, would be important on this one. Let's go back to you.
All right, good to know. Thank you, Randy.